Hello, Bobby. How are you?
Good, thank you.
Have you had any further reactions since the last time I saw you?
No, none.
That's very good. Do remember to avoid what you are allergic to. That's your best prevention of not having anaphylaxis. Okay, we brought you in here to review your anaphylaxis kit, which should contain 2 Jext, antihistamine tablets, and your asthma spray, if you've got asthma.
Yeah, I've got it here in my bag. It's quite big, so I have to remember to take it everywhere I go.
It is very important that you take it with you at all times. You never know when you're going to have an anaphylactic episode. If you have a lump coming up in the back of your throat, if your breathing gets very noisy, which is called wheezing, and if you start to feel faint, then it's time to use your Jext.
Yeah, I remember starting to feel faint. I got this funny feeling that something terrible was going to happen to me.
That's actually very common in anaphylaxis. It's called the feeling of doom. Then you definitely need to use your Jext. All right, you need to take it out of your flip-top case. Hold it in your dominant hand, having your thumb closest to the yellow cap. Take the yellow cap off. It can go through closing, that is not a problem. Hold it onto your outer thigh and then push it into your thigh firmly. After you heard the click, count 1 elephant, 2 elephant, 3 elephant, 4 elephant, up to 10 elephant. That is especially important when you have the feeling of doom, because people tend to come 1, 2, 3, 4, 5, 6, 7, and 8, 10. After 10 elephant, take the Jext out and rub the area for 10 seconds. When you use the Jext, you must go to the A&E department. If you are by yourself, take the Jext first and then call the ambulance. If somebody else is with you, they can call the ambulance while you are giving your Jext. You must say the word anaphylaxis or severe allergic reaction. That will trigger a faster response. If you have got anaphylaxis, the safest place to be is on the floor. If you can tolerate it, lie flat on the floor and have your legs elevated on the wall. That will help you with the dizziness and will make you feel better. If you can't tolerate it with the asthma, sit up and have your legs on a table or a chair. Your legs need to be higher than your heart for this to work. If you need to get up, don't. It's quite likely, if you get up too quickly, that your blood pressure will drop and you will faint and hurt yourself even more. If you really have to get up, do it extremely slowly. Sit up for a while. If you have the feeling you're getting dizzy again, lie back down again and have your legs elevated.
What if my symptoms don't start to get better?
If after 5 to 10 minutes you have the feeling I'm not getting any better and the ambulance hasn't arrived, use your second Jext. Again, put it into your fist. Thumb closest to the yellow cap. Take the yellow cap off, hold it against your thigh, push it onto your thigh. Count 1 elephant, 2 elephant, 3 elephant, 4 elephant, up to 10 elephants. Take it out afterwards and rub the area for 10 seconds.
And does that need to be in the same leg as before?
No, it can be the other leg. That is not a problem.
When do I take my antihistamine tablets?
You can take your antihistamine tablets before or after the Jext. For example, if you have the feeling there's a lump coming up in the back of your throat and you can't swallow your own saliva anymore, then take the Jext first and take your antihistamine tablets when the symptoms have calmed down. However, if you have the feeling you're only having an itch at the moment and you're not sure if this is going to develop into anaphylaxis, you can then take your antihistamine tablets, and if 5 to 10 minutes later you have the feeling, actually my throat is getting very tight and I'm getting wheezy, you can then take your Jext. When the ambulance drivers come, I want you to give them the used Jext. They will dispose of it safely. Before you leave the A&E department, you either should get new Jext or a prescription for some. Please get it filled as soon as possible. Once a month, I would like you to take your Jext out. Take it out of its protective casing and check the expiry date. If it expires within that month, then get a new one. And have a look also at the adrenaline. It should always be clear. If for some reason it's discolored, then get a new one from your GP. And just recall how to use it. Any more questions?
No, thank you.
Here's the Anaphylaxis Emergency Kit leaflet. It has all the information in there we've discussed earlier on. There's also more information on the King's website and the jext.co.uk website. Thank you very much. I'll see you in a year.
Lovely, thank you.
Take care, bye-bye.